and welcome to On Call After Hours, where we answer the questions we weren't able to get to during the show. We've got 30 more to go. All of your questions are important to us. We want to answer as many as we can for you. So we're going to fly through these, okay? Should someone with diabetes take vitamin B12?
Dr. Holm says yes.
And I'd say yes. What do you think?
It's not going to hurt.
Discuss fibromyalgia. Are there foods that would help? What about medications? How can you deal with this? Fibromyalgia.
Tough thing to treat. So what you're going to do is make sure you're active. There are some medications. Depends upon what you have for diseases and stuff, so I'd talk to your doctor.
Yep, and I like the Effexor. It's a good choice. But I agree, exercise is the most important thing.
Absolutely, and a good night's sleep.
Caller has type 2 diabetes for 16 years. His feet are swollen and hurt. Always takes 6 to 8 Tylenol a day. How can he control his foot pain?
He needs to go and get that leg swelling evaluated and treated.
Support hose and diuretics and get him up and stop the Tylenol.
I tell people your heart pumps the blood down, activity gets it up, so if you got them down, get them up.
Rapid City, 2 knees scoped in 2004 has some nerve damage in the right foot. We'll be having knee replacements now. Will it cause more nerve damage?
Maybe.
Unlikely, but possible.
Is strep throat contagious? How long after starting medication before they can be around people again?
Very contagious. We had a nurse that kid would walk into ER with strep throat and they would get it every time. 24 hours of medication and should be okay to play around with other kids.
What is the name of the flower on the logo, and is it blooming right now? It's the Pask flower, and it's blooming right now somewhere.
Boy,
good question.
10 points.
Woohoo! Does long-term use of statin medications cause diabetes, and is this why diabetes is on the increase?
Highly debatable question. I don't think so personally.
I don't think it's the reason for the increase. Obesity is probably
decreased activity and obesity.
Decreased activity, that's the major deal. Statin, though, if it gives you symptoms, don't go there. I mean, the benefit is a little bit for if you've had heart disease and not a lot if you haven't. Has had shingles once. How often do you get it twice? Is it the worst the second time? Twice shingles.
Yes, you can get it twice. I've had them. I get it the third time. Unfortunately, you can. Probably should talk to your doctor just to make sure you got your blood counts right and you're not have an immune problem.
Right. Do you believe in the vaccination for these people?
I wish it was a better vaccination. 50% effective, reduces the risks from 20% to 10%, and if you've had the shingles, from 10% to 5%. So yes, you can't get it if you have any cancer treatments going on because it's a live virus. I wish it was a better vaccine.
And you can't be around anybody that's pregnant or any kid less than a year of age. I use it because I think it's better than nothing.
Right.
And if you have to treat these people with chronic pain because of the herpes, the zoster, good luck.
I've had some people get it right after the shingles shot, but you know, I think they got it a lot less than they would have. Yeah. Has diabetes under control now at age 64? Can you control it into the older age?
Are you overweight? And if you are, get it gone, and you can. That's your best exercise. And weight loss are your best options.
Did you hear that? They're saying exercise. I didn't say it. It wasn't me saying it.
And the reason why is because the diabetes, you have insulin resistance, and so you're trying to overcome that. And how do you do it? Is increase your activity.
Yeah, boy, it's huge. What causes leg and muscle cramps at night?
Could be electrolyte imbalance. Quite often they don't get enough fluids. Did you stand on a ladder all day long? You're doing something you're not used to doing?
I think that's the biggest. They're doing something they haven't been doing regularly. And so I just jump out and stretch them immediately, just stretch them immediately.
My clientele are mainly the elderly, and so much of it is fluid shifting. So if you're sitting and you get your legs swollen all day, then you get them up, the fluid shifts and you cramp. So if you wear tight socks, or if you got leg swelling, get them up during the day, and that'll diminish your leg cramps.
Support hose, wonderful thing. 20 to 20-pound support hose. Has a hard flesh on bottom of feet. It's painful. Has it removed but grows back. Is it a corn, a callus, or something else, and what to do about it?
I'd have to see that one.
Yeah.
I think it's a callus, and I think he's got a malformation, a bony projection, and if he had his foot formed perfectly with a podiatrist or physical therapy people, sometimes you put a mold of it, then you have that special thing, it'll take the weight off that callus.
And you tell a difference, like a corn, which is a particular kind of callus, the lines, the skin lines go through it, versus a wart, the skin lines go around it.
So a wart it might be a wart too, that's exactly right. Talk about steroid shots for joint pain, do they really work?
Amen.
They do.
I had a new knee, and I used that for a long time beforehand. So yes, but you just don't overdo it. So there are some people that doesn't. The joints are so bad, but most people it will.
It'll give them 3 months.
Yep.
Buys time.
It does. I think it's the underused thing. Vaccines for children, good or bad? What's recommended?
Follow the current recommendations of CDC. They're good for children, I think.
Do you spread them out? I mean, you're the vaccination for kids thing. I mean, a lot of people want them spread out, not all at these times.
My honest opinion is
Yeah.
if you're cruel and unusual punishment, if you want to do that, go right ahead. Other than that, no, don't do that, because it doesn't have any increased risk if you give them together. The scientific evidence does not show that at all.
Take them the way they're recommended.
Take them the way they're recommended, and yes, you can get like 5, 6 more at a time. It's okay.
And it saves lives.
I want to give just a brief story. My granddaughter needed open heart surgery when she was 6 weeks down at University of Iowa. Went in to visit her post-op in the pediatric intensive care unit. And next door were 2 kids that were probably going to die from whooping cough because they had not been immunized. And it just brought it back to me how important these things are.
People don't realize.
Now, Minnesota's had, as of November last year, last I heard, they had 200 to 300 cases. Pertussis or whooping cough, same thing. It's out there. Get your kids immunized.
That just makes all the difference. Has a pacemaker? What must they be careful of? Microwaves.
Not anymore. Microwave, they should have a microwave shield on it. You need to avoid electromagnetic radiation, such as if you like to tune cars, you shouldn't do that. Arc welding, electric fences.
MRI.
MRI. They're not getting an MRI. But you cannot damage the pacemaker. All it does is it changes to its backup mode. Then you have to go get it reprogrammed.
Right. So it isn't a dangerous. It just changes it back to the. Here's my standard mode, and you have to get that recalibrated.
Right.
What is a Baker's cyst, and what can make the pain go away? We asked that during the show, so we'll skip that one. Here is what TSH level should be concerned about. TSH is thyroid stimulating hormone, and when the person's thyroid is burning out and getting low, what does the TSH do?
TSH is going to go high. And by that, I gave this presentation back 25 years ago down at Brookings Hospital.
Brookings,
yes.
When you were a resident with us.
And you talk about being, what numbers you get worried about. Well, when you're on medication, you want it below 2.5, and I think it's about 0.2, I think was the lower number. But they can be up. It's called subclinical hypothyroidism, meaning it's up a little bit above that 4, which is without medication. You're 4, 6 maybe. Depends upon the symptoms.
I start them probably a little bit earlier than a lot of endocrinologists.
I do too.
If they're kind of luggy and their TSH is above normal, what the heck, give them 25 micrograms.
Give it a trial.
See how they do. Kim?
I give the patient their choice. If they're feeling good, we'll just recheck it again in 3 or 6 months.
That's the smart thing, really. You and I are being too aggressive.
Well, they've got symptoms when we do it.
Yeah. Neuropathy in the feet, that means numbness, tingling, nerve loss. Get hot at night, talk about neuropathy, what can be done for treatment? Well, we make sure that their thyroid is okay, and we check their B12.
Well, figure out what it is, number one, if there's a reversible or correctable cause. And then there's some just darn good medicines out there that if it's really keeping you awake at night and making you miserable, go and...
Which medicine do you like?
Well, like you, I start with gabapentin because it's cheap, effective, not a lot of side effects, but Lyrica is great. It's expensive, though.
Amitriptyline and nortriptyline.
Whoa, there we go.
Is your chair, are you breaking my chair?
I'm sorry. I'm excited.
Yeah. In hospital for 2 nights, under observation for a fall and surgery, never classified, admitted, and therefore didn't qualify for nursing home care. 2 nights, not 3,
Yeah.
didn't qualify for nursing home care. That means 2 weeks of Medicare payment. And generally, I guess they started with observation, then they went into the hospital, didn't get the, what's your comment about that?
There is rumor that they're going to be changing that. They're looking at possibly getting rid of that, or at least changing it, but it's just a rumor at this point.
It's a government rule.
Yes.
It's my opinion is it's cost shifting, and it's shifting it in adversely to the patient.
Yeah.
I just really don't like that program.
No, and I generally admit when a person needs to be in the hospital, I mean, rarely I'll put them in observe. Other people do a lot of observation admission because I'm not sure what it is, and therefore I don't want to take a risk and nail it and call it this. But I admit them when.
I'm with you.
Yeah. And then you get the first midnight, and you got 3 midnights, then you can get 2 weeks of nursing home care. For goodness sake, they stay for 2 years. I mean,
Yeah.
doesn't matter anyway, really. My mom's a classic story of that, but let's not go there. Why do smokers often stay slim but gain weight when they quit? Aaron.
Smokers, quite often when you smoke, it affects your taste buds. You can't smell as well. You can't taste as well. And there you quit that. You can taste. They can finally go in and get some decent meal, and they all talk about, man, I didn't realize I was missing all this, and they can smell. And they're used to doing this multiple times a day, and so they start doing this multiple times a day. So now they can smell, taste, and they got the hand movements.
Yeah.
Can I make one real quick comment?
Yeah.
My smokers, I'm like Kim. But I say, you know what? You can tell when I don't like you. I will quit asking you to quit smoking. Are you ready to quit yet? We'll go the first time through the risks and hazards of cigarette smoking.
And
it's
then
not if you get cancer, it's when and stuff. But I said, whenever you're ready, let me know. And every time I'll ask. I had one come in with them the last week and say, after 15 years, I swear we've been working on these, I'm ready to quit. And I tell them, so you're ready to quit. This is the time to do it. Yeah, I know. I still like it, but I have to quit. I don't blame you. So.
Keep harassing them, Aaron. That's the way to do it. Hendricks, Minnesota, APF disease, antiphospholipid antibody syndrome. What is it? Daughter has it. What can we do? Kim.
Well, it's in the autoimmune family again, where you're attacking an important chemical in the sequence of forming blood clots. And it puts you at risk for forming blood clots. And if you've ever had one, then you are on lifetime anticoagulation.
Yeah. See, what a smart guy these two guys are. And that one's a wonderful answer. And of course, his children beat my kids at debate all the darn time. You know, blasted those darn wildy debater kids. Is there a correlation between B12 and cancer?
Never heard of one.
Haven't heard.
I haven't heard it either. Certainly anemia. And then there's times when if you got cancer, you can...
All right, there might be pernicious anemia. There probably is a slight risk of stomach cancer. If you are without hydrochloric acid in your stomach a long enough time, but boy, that's a stretch. That's a real stretch.
I think I've seen one.
It's a stretch.
It is a stretch.
I'm a 20-year-old female, been constantly exhausted. Amount of sleep I get doesn't change my energy level. Tried sleeping anywhere from 6 to 13 hours a night. Bruising sensation all over my body. Doctors haven't been helpful. Done allergy testing, blood tests are normal. If you have any advice, who could I see who might be helping with my issues of exhaustion and energy and bruising sensation?
It's in your category, my friend.
My category. You know, they don't talk about their weight, so are they overweight? Do they have some sleep apnea?
Sleep apnea is certainly something to check.
I have had, this is a 20-year-old, I believe. I've had a lot of, well, I'm getting enough sleep. Well, what time do you go to sleep? Well, I go to bed at 12. You know, and what time do you, well, I have to get up at 6 or 7. So they're not really getting enough good sleep. 8 to 9 hours they need at that age. The other stuff is just kind of a mixed bag of bruising and stuff. So there's unanswered question.
Certainly if the blood tests are okay and there's no leukemia or anything like that, my sense is that I would treat this with a combination of an SSRI because it helps with energy. Use the kind of the energizing thing like Prozac, I mean one of those, but most important, an exercise program.
There you go.
Hello, should one consider taking brand name Coumadin versus generic warfarin? I've been on it for years because I have a mechanical heart valve.
No.
Doesn't matter. I've gone to
I go to
generic.
the cheap
Seen
stuff.
one case where they end up in the hospital, got a rash, came in the hospital, given name brand, rash went away. Back and forth. This was 25 years ago. It was due to the generic. Other than that, no.
No. I
use
think
generics.
use the generic, monitor their warfarin, and then you see where you're at. I mean, you're monitoring
But
their
try
warfarin.
and stay on the same generic.
Yeah. And if they switch it all the time, you yell at your pharmacist.
Yeah.
Come on, you can't switch me. Just stick
Because
with
it
one.
can make a difference.
Volga, 3 months, right side of face is numb. What is it and what can be done? Numb face. Well, there's the paralyzed face, the person with Bell's palsy.
Right.
And they have, that sometimes goes away, but sometimes it doesn't.
You need to have that looked at. I mean, there's a number of tumors that could be there. You could have had a small, was there an age on that one?
No,
not.
3 months, right side of the face is numb.
Small stroke tumor in one of the cranial nerves.
MS.
MS, you need to go get it
I
evaluated.
think probably an MRI. That's one I'd probably do an MRI.
Yeah.
Maybe a lumbar puncture. You could even get that with syphilis. That just threw her for an absolute loop. I don't mean
Syphilis,
to do that.
well,
Syphilis is the great
Lyme's
mimicker.
disease and
We need to talk about syphilis. It's happening again, but that's not what it is. Okay, so I did that to make the point about scaring people to be protected for syphilis. Is there a particular amount of sleep someone with narcolepsy needs to reduce symptoms during the day? Any food, drink that would help reduce symptoms? Narcolepsy, migraines, and narcolepsy.
You should be taking a medication for narcolepsy. So that's number one.
Yeah.
And
Migraines correlated?
I don't have an answer for that.
I have an answer for her. Carol Miles.
Oh,
Oh, yeah.
She
excellent.
is so wonderful. Seek a neurologist, and Dr. Miles, the migraine guru of the Midwest.
Headache Clinic in Sioux Falls.
Yes.
Great idea.
Scleroderma. What is it?
All right, two kinds of scleroderma. There's a localized one, which you get these patches of round circular things. You don't like them, but they don't cause anything bad. But then there's the systemic kind, which can cause bad stuff. Lungs, kidney, you can circulation to the hands and feet. And so if you have the truly systemic,
You could have Raynaud's phenomena with that.
right, you need to see a rheumatologist. And
And they can't do anything either,
Yeah.
can they? I mean, the truth is, it's a progressive disease.
correct.
We don't have much for it.
tough
That's the
one.
bad news.
Tough one. But if it's the skin one, it's
And I found this, that in some cases, the scleroderma is much slower than others. It depends, it varies. This progression is, hopefully your scleroderma ages with you and you die in your mid-90s of a jealous lover.
The last one I had died in her mid-90s, but not of a jealous lover.
Oh,
so you
okay,
can lead
yeah.
a long life.
Yeah, and it can be bad too.
There you go.
Anything, Aaron?
No comments.
Has progress been made in the treatment of progressive supranuclear palsy?
Ooh. I don't know.
That's a particular neurologic disease, and I don't know of any progress on it.
I don't either. But I don't know much about it.
Have you ever seen a case?
I think that it has to do with little strokes sometimes, but you know what? I don't know enough.
Yep.
You stumped all three of us. We got to look that one up. When I don't know enough about something, you just put it out there.
Well, it's in the family of dementias. And if you have somebody and you think has Alzheimer's type dementia, progressive supranuclear palsy is in that category, and the hallmark of it is you can't look up. Everybody else can look their eyes around, but you can't look up. But I'm still not aware that there's any treatment or any other specific way to diagnose it except clinically.
See, there's why we brought Wilde along here, you know what I mean?
The walking book.
Right, yeah.
Peer, dry mouth on meds for it. Why does this show up suddenly? Can it be caused by meds?
Absolutely.
The most common cause is meds. What meds?
Amitriptyline, nortriptyline are some of the worst ones.
Vesicare.
Scopolamine for dizziness.
The bladder.
Antihistamines?
The bladder, antihistamines, the decongestants. What else?
Oh, boy.
All those every single bladder drug.
Right.
They hit those same areas.
Drugs for
Irritable bowel.
Irritable bowel.
Bentyl and
the Benylin and all of the irritable bowel drugs. That's the most common cause, but then there's a condition, I mean, it's an immune system disease too. I mean, it can be just like scleroderma or rheumatoid arthritis or Raynaud's. It's immune system. It might be proteins that particularly attack your saliva glands. How is that?
Great.
Here's from Belfouche, having an EMG conduction test for spinal stenosis. Day before this test, we'll have a procedure done with Novocaine similar to a painkiller. Will that interfere with the EMG? So he's going to have a skin lesion removed with Novocaine. Will that affect the EMG?
None.
No. IBS, irritable bowel syndrome, terrible rash on bottom. What can she do to
Or
relieve the itching?
inflammatory bowel.
Itching and pain, also low cholesterol. Can it be too low? So let's do the cholesterol question. Can the cholesterol be too low? If you're on drugs?
Yes.
Yes. If you're not on drugs?
No.
No.
Okay, so rash on the bottom, you worry about that this is not irritable bowel. What?
Ulcerative colitis, Crohn's disease,
Right.
infections.
Right, different kind. Well, even parasitic infections, Giardia can do all of this. But it might be that it's just irritable bowel, and then there's this super cleansing syndrome where they clean all the time, and all of the cleansing can dry up the skin, and you can have a terrible itchy rash on the bottom related to too much cleansing and soap and rubbing. And the most important treatment is, are you ready? CeraVe.
I have it written down. Yep.
Gastroenterologist recommended wash off with like a shower head. Just wash it off. Do not use a washcloth or soap.
No washcloth, no soap. I say never soap on the bottom. No scratching, no rubbing. Don't put your finger up there and clean up high.
Is
Keep
that we gonna end
the
on
less
that one?
the less you do, the better. That's probably it. Any take-home messages?
You've said it all.
All right.
Well, thank you.
Thank you for joining us on our website. We appreciate all of your questions and the opportunity to answer them. Be sure to join us next week, South Dakota Public Broadcasting, at your regular time, and call in and email your questions. And until next time, stay healthy out there, people.